House Bill 937, the TennCare Fiscal Responsibility Act, blocks the expansion of Medicaid pursuant to Obamacare. The reason that I brought this bill is because I feel like taxpayers cannot afford the long-term financial burden of expanding Medicaid. I feel like we've been here back in 2005 when Governor Bredesen had to trim off 172,000 Tennesseans off our TennCare rolls because it was bankrupting our state. If we expanded Medicaid, we would be putting 180,000 people back onto the rolls by 2019. A lot of people think that we need to take the federal money, but I just feel like that's a bad idea. The Hospital Association's own statistics show that about 4 in 10 Tennesseans believe that the federal government will not live up to its end of the bargain. They already have $16.5 trillion in debt, and they have a hard time paying their bills as it is. So I don't really think that we should be relying on that funds as a guarantee. You also have to think about factors. If you're going to spend this much money on one industry, that takes money out of the economy. That takes money up from every other industry. Basically what you're doing is you're taking money out of the private market and away from Tennessee taxpayers, and you're giving it to Barack Obama in Washington, D.C. I just don't think that's a good idea.
And so does the dialogue that's coming from the hospitals, does that affect your position with this bill?
I do believe that some of the concerns about the hospitals are well-founded. Their dish payments were cut by 75%. However, you have to remember that many of these patients would be much better off on the private exchanges, like the 100 to 138% group, comparing it to the federal poverty level. They could go into the exchanges, and the exchanges, we assume, will pay more than Medicaid. Medicare pays more than Medicaid, and private insurance pays more than Medicare. So I would think that that would give those patients better access to quality health care and would reimburse the hospitals at a higher rate. But you have to remember, even if it were a better deal, there's always some reason to take federal money and to violate conservative principles and good judgment. But that's the exact same mindset that's put our country in the dire fiscal straits where we find ourselves today. So we just have to be conservative. We have to learn from our past. We have to just make sure that we keep in mind the long-term financial future of our state. So I believe we should say no to Obamacare.